Hi everyone. So we're talking all things lower back and SIJ pain. We often get patients in the clinic who come in thinking that they've been experiencing lower back pain, and upon a more thorough investigation we actually determine that it's not their lower back that's causing their pain, it's actually their SIJ, their sacroiliac joint. If that's a term that you haven't heard before, just a quick little recap on what the SIJ is. So at the bottom of your lumbar spine, your lower back, where your lower back joins your pelvis, we have the left and the right sacroiliac joint. And they're long, flat-like joints that really help to join the hips into the spine. So they're quite important because they help in transferring the ground reaction force from your legs or from your limbs, and that load goes through the SIJ and then joins up into the lumbar spine. So it's a common area for, misdiagnosis or not being sure about where the symptoms are actually coming from. And sometimes between 15 to 30% of people who think they have lower back pain actually have SIJ pain. So it's really important when you're trying to rehabilitate an injury or you've got symptoms or pain that you want to get on top of, that you really understand where that pain is actually coming from. Because obviously, if you have SIJ pain and you're treating it like it was pain coming from your lumbar spine, then the rehab or treatment that you undertake is probably not going to be very effective. So more than 50% of the people we treat in clinic that have got lower back pain or thought they had lower back pain, and they've had it for a long period of time, and they often explain that they've seen chiro and physio and osteo and massage, and they've done Pilates and they've worked at the gym and they've got a personal trainer, but nothing ever helps. More than 50% of those people actually don't have lower back pain. When we investigate properly, they've got SIJ pain. So what I wanted to give to you guys today is just 3 quick ways that you might be able to use at home to start to determine, hold on, do I actually have lower back pain or do I have SIJ pain? Because getting that diagnosis correct is really important. So the first way you can figure this out is have a think about what is a position that is more easing, that gives you more relief when you have a flare-up. So if you're in a lot of pain, you've had a flare-up, things have gotten aggravated, do you prefer lying flat on your back and that's actually more relieving? Or do you prefer lying on your left-hand side or your right-hand side? So if you answered flat on your back, then the chances that your pain is coming from your lower back are fairly high. If you answered no, lying flat on my lower back is not helpful, actually it's sometimes worse, but actually lying on my left-hand side or my right-hand side is better, then the chances are your pain is actually coming from your SIJ, your sacroiliac joint. So that's the first test that you can do at home to check. Do I prefer lying on my back, in which case you get a point for more likely to be lumbar spine pain, lower back pain? Or do I prefer to lie on my side, in which case you get a point for more likely being sacroiliac joint pain? Okay, the next thing you can ask yourself is, what aggravates me? So what are the types of things that I usually have done when I've had a flare-up? Now, if it's more likely your lumbar spine, you're going to answer with things like bending down to pick something up, lifting something, sitting for too long, sometimes coughing or sneezing or straining to go to the bathroom. Often you'll describe, if you're a patient, your hip flexors feel particularly tight or your hamstrings feel particularly tight. These are all things that usually resonate more with someone who really does have lower back pain. However, if when thinking about the things that have aggravated your symptoms or made you feel worse, you say things like, I really don't like standing on one leg to put on my undies or to put on socks or shoes. I don't like going upstairs, that one leg type movement, that unilateral type movement is quite painful. Then actually the chances are it's more likely your SIJ that's causing you the problems. So my second tip is think about what activities aggravate you, and are they more likely the lumbar spine category? So things like bending, lifting, coughing, sneezing, squatting, tight hip flexors, tight hamstrings, lumbar spine pain, more likely. Or are they unilateral tasks, one-legged tasks, putting on undies, socks, walking upstairs, sometimes single leg movements if you're in the Pilates studio doing scooter, or if you're doing yoga, things like tree pose, things where you're standing on one leg for a period of time. Then you're more likely thinking we're going to be looking at SIJ pain. So those are the first 2 questions. The final question you can ask yourself is now thinking about, okay, I've had a flare-up. What kind of things do I do that make my flare-up actually feel alleviating? They feel like, oh, that feels better. So if you say things like stretching my hip flexors, tractioning my lumbar spine. So sometimes people feel like they want to put their hand on a bench in a chair and sort of hang their lower back, or reach up on top of a door handle and hang door frame and hang their lower back. Those kind of things are more likely helping your lumbar spine. So chances are the pain is actually coming from your lower back. However, if you say things like, no, I feel like when I get a spiky ball and I just have to release one side of my pelvis or one side of my glute, or I have to do a figure 4 glute stretch, but much more on one side than the other, those type of things more likely lead you towards thinking, actually, this is more likely to be SIJ pain. So you've got 3 questions that you can check now at home by yourself. Your first one is, what do I like, flat on my back or on my side? Which one of those is better? So flat on my back, point for lumbar spine, on my side, point for SIJ pain. Second question is, what things have usually aggravated me? Bending, lifting, coughing, sneezing, point for lower back pain, or single-legged activities, putting on socks, undies, walking upstairs, single-leg postures in yoga or Pilates, point for SIJ pain. And the last one is, what do I like to do that alleviates my pain? Traction, hanging my spine, child's pose, tractioning, hanging off the door handle, stretching my hip flexors, point for lumbar spine pain? Or is it more likely releasing glutes on one side, figure 4 stretch, one side of my hip feels tighter than the other, point for SIJ pain? Now, I will say that the best outcome in this is that when you ask yourself these questions, you get all 3 answers in one category. So you answer to question 1, 2, and 3, all positive for the SIJ pain. It's pretty likely that it's actually SIJ pain you've got. Or you answer for questions 1, 2, and 3, all positive for lumbar spine pain, then it's pretty likely you've got lumbar spine pain. There may be some of you who do this at home and you get a couple for lumbar spine pain and a couple for SIJ pain. And that's okay, because sometimes you actually have both. Sometimes, unfortunately, you've had lumbar spine pain, which then becomes pelvic girdle or SIJ pain because of the way that you've been functioning, or vice versa. You've had SIJ pain that actually also then becomes lumbar spine pain again because of the way you've been functioning, which is why we always say, don't put your injuries in the too hard basket, because often they just compound. Once you've got a problem somewhere, it's really a good idea to try and seek out some advice and get on top of that problem. If you've got more questions, so if all of that was a little bit helpful but also a little bit confusing and you want to ask some more questions, make sure you comment below, because we always answer our comments. So the best thing I can do for you is start to talk through some of those symptoms with you and give you a good idea of where you fit most likely in the symptoms box. The other thing you can do is give the girls a call. So we've got 3 studios in Sydney. We've got Caringbah, Helston Park and Alexandria, and a team of really experienced physiotherapists and Pilates instructors who would love to be able to work with you and help you to sort out where your pain is coming from, and then create a treatment plan to be able to alleviate it and make sure it doesn't come back. So if you think that that would be helpful, by all means give the girls a call, and you can find that number either down in the comments or linked in the website, hopefully up here, or if you're on social media, just on our Facebook page or our Instagram page. So I hope that was helpful. Like I said, any questions, make sure you comment below. Otherwise, I will see you guys next time. See you later. Bye.